Welcome to Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Hello, this is Jason Edwards, and this is Doc Discussions. I'm here with Dr. Mason, John Mason, our Chief of Surgery, and this is our second episode with Dr. Mason. How you doing, sir?
Just fine. Thanks for having me again. This is great.
And so after our first episode, when we turned the mics off, you and I had a very interesting conversation, and I thought, this is something we should probably record. You were a collegiate athlete in rowing. Is that right?
That's correct.
And where were you rowing at?
UC Santa Barbara.
And that's a Division I college?
Yeah.
And not all colleges have rowing. And so I would assume that the ones that do are actually, have fairly good rowers because there's.
In general, yeah. It's a significant commitment for all the equipment. I think most programs that have a rowing program, they're not just going to get sort of one or two boats. It's a little bit of an all or none proposition. So it's either they're going to have a rowing program or not. It's interesting. Rowing is actually the oldest intercollegiate sport in the United States.
Okay, I would assume Harvard's one of the first colleges, and they probably had it.
The first, and not just of rowing, but of any sport, including baseball, basketball, football, everything. The very first athletic competition between two schools was rowing.
Okay,
and it was Harvard Yale back. I think the year was 1846.
Okay, so before some of these sports were even invented.
Oh yeah, exactly.
And so I'm going to fast forward a little bit. So after college, you were actually in the Olympic trials. Is that correct?
Well, yeah. So I didn't quite make it that far. So during my collegiate rowing, I rowed 3 years in college. I unfortunately developed a shoulder injury during my third year that required surgery. But after my second year and after my third year, I tried out for the national team, and there were sort of three modes of assessment, if you will. You did 6 minutes on a rowing machine.
Okay.
And this was kind of a bizarre rowing machine. Rowing machines are very commonplace now, especially the Concept 2, which we have one here in the first floor of this building.
Thanks, Steve.
And that's CrossFit gyms use the Concept 2 rower. You see them in gyms and people's houses everywhere. This was, the mid 80s. In Concept 2 that company was just starting, and I can't even remember the name of the rowing machine, but the coach, the United States Olympic coach, was a guy named Chris Korzanowski, who was he was from Poland, spoke sort of okay English, and he had this Polish rowing machine that he kind of brought over. It's like, oh no, this is what we will test all the athletes on. So we had to do a 6 minute, piece, or 6 minutes on the rower, try and, pull as hard and fast as you could over that 6 minutes. And then you had to, do what's called a bench pull, basically where you're laying on a bench and it's basically, weightlifting, kind of a bent over row, but on a bench facing down with 90 pounds in 6 minutes. See how many times you could do that. And then the other component was flexibility, just seeing how flexible you were and everything.
And so you made it somewhere through the process.
I did very well in the flexibility, and on the rowing with the barbell. My rowing machine time was kind of okay, but it wasn't competitive enough to make it to the next. That was sort of the screening thing. You went through that initial screening, and then if you made it past that, then they invited you back to Philadelphia, which was sort of the center of United States rowing at the time. I think currently it moved to Indianapolis and Oklahoma of all places. I'll be honest, I'm not sure where. I think it's in Chula Vista, California now.
Okay,
they go to kind of bizarre places. So in any event,
and so you were rowing and staying very exercising a lot, then you were like at a fair or at a park, and you noticed you were having some heart issues.
Yeah, this was many years later. So I kind of joke around that maybe the shoulder injury I got, was sort of the best thing that happened, at least to my surgical career. I was sort of toying with the idea of medical school at the time. And then it's like, well, okay, I have to set up my senior year of rowing. What else am I going to do? I'm going to hit the books hard and study for the MCAT. got into Washington University for medical school, came here, and then, did med school, residency, and so on. Enjoyed rowing. And there's actually, and so that going to WashU, of course, meant that I moved from California to St. Louis. So I've been here ever since then. But there is a rowing club here in St. Louis, a very good one, especially as far as the high school program. But they have master's rowing too. So I rowed with them for many years. And then, right around me turning 40, I was with a group of guys. We were really competitive. I was, one of my, at age 40, we would have these indoor rowing competitions, which is kind of a big thing. And we did it with Washington University, and I beat all the college kids, so I was very proud of that. But shortly after that, I was at a picnic with my family. My son was, who's bigger than I am now, was a little toddler. I was carrying him up this hill, and I thought a bug flew in my shirt. It's like, oh, what's this shaking in my shirt? Something's in there. And I was in atrial fibrillation. Went to St. Luke's. I was, a surgeon here at St. Luke's at the time, went to the ER, and they did an EKG and said, oh, sure enough, you're in atrial fibrillation. And then subsequently got an echocardiogram, and I had mitral regurgitation. So one of my heart valves was leaking pretty significantly, but I had no symptoms. That's what really kind of surprised me. I had no shortness of breath. In fact, not only did I have no shortness of breath, I was, competing in rowing, which is a very, aerobically demanding sport. And I felt spectacular. So I almost didn't believe the results.
Yeah.
But I get, but the AFib was, atrial fibrillation kind of convinced me, okay, well, something's going on. And so I saw one of our cardiologists here, Dr. Davison, who I'm still good friends with.
Yeah, sure,
He's a
Glenn.
great cardiologist. And
total
said,
character.
Yep. And he said, well, you're doing well. And he put me on some medication that got me out of atrial fibrillation. Thankfully, I did not have to be anticoagulated. So he said, well, you know what? You're doing fine, minimal symptoms. Let's just watch you for a while. We'll get another echocardiogram in 6 months.
Okay.
So it's like, okay. And then I never went back into AFib. Actually, to this day, I've never gone back into AFib, thankfully. But had the echo 6 months later, and I continued to be physically active, continued to do rowing races. In fact, I won a single scull, a one-person boat competition down in Atlanta, which was, actually it was Chattanooga.
Okay.
Really huge competition. I was, just absolutely thrilled. And then I had my repeat echo, and they said, oh, it's gotten way worse, and you're actually in heart failure now, which I just couldn't believe because I still felt completely fine. So the writing was on the wall. I had to get the valve repaired.
And so this is an open heart surgery.
Yeah. So
this is no small surgery.
Correct. Yeah. This was 2005, 2006. So there were, some institutions were just kind of exploring kind of less invasive ways.
A catheter-based.
Right.
But take me to your mental state. Now, you're a doctor, you've started your practice, and now you've got a beautiful wife.
Yeah.
And you've got two
kids.
Two children
kids at the
that are
time,
tiny. And this has to make you consider your own mortality probably for the first time.
Yeah, it's funny you mentioned that. The reality of it didn't sink in until the day of surgery. And I remember talking to the anesthesiologist, and I ended up having it at Missouri Baptist, nothing against St. Luke's great heart program. I'd been here maybe 3 years, and I felt I had these weird visions of, I don't know, me like dying in the intensive care unit. It's like, okay, I don't want to die in the hospital where I work. And I knew Dr. Kachukas from my residency training really well. And I said, you know what, I think it's best if I just go offsite.
It's also awkward too, because in the OR, you're completely naked too.
Yes.
And being around people you work with completely naked, you would think as a doctor it's not that big a deal, but it's not the most fun thought.
That played into it as well.
A little bit, right?
Yeah. Just, kind of the privacy
for sure.
Aspect of
for
it.
Sure.
That was part of it. And so, the morning of the heart surgery, I remember, my wife drove me to the hospital. I remember there was a pretty rainbow, and it's like, okay, I think things are going to be okay. But again, that just the whole it just seems so. I felt fine. I mean, it really took a leap of faith for me because usually you have some huge operation. You have, I don't know, blood in your stool, or you're losing weight, or you feel terrible, or something's going on. But
you were in such good shape that your body was able to compensate for it. Yeah. A mere mortal would have symptoms.
Correct. Yeah. I think that was probably the thing. So, So in any event, I remember meeting the anesthesiologist, who was just an extremely nice guy. And it's like, oh wow, this is real. And then, then had the surgery. Everything went fine. Went home, I think, in 4 days. But then I did have pericardial tamponade about post-op day 10 or
and
so.
I'm going to explain to people what that is. So
sure.
there's a sac around the heart, and that's where blood gets into that sac and starts putting pressure on the heart from the outside in. So the heart's not able to pump as effectively, and so you have decreased blood flow throughout the body.
Correct. That's correct. And here is where I was the exception again. I remember I started not feeling well. It was a Saturday night. I'd been home for about, 5-6 days, taking my daily walks. Everything was great. And it was a Saturday. My wife had a birthday party to go to. And I remember she felt really bad. She's like, okay, I'm going to go to this party for about 2 hours. Are you okay by yourself? And it was just me and the two kids. And my son was, I think, 1.5 years or 2 at the time. He'd already gone to bed. So my 5-year-old and I were just hanging out. And like, we're fine. We'll be fine. Lauren will take care of me. And, I remember getting up and was walking across, and I started getting nausea, and I collapsed. And my 5-year-old was there, and she ran and got a washcloth, and I kind of came up, and she's like, "Oh, are you okay? Are you okay?" And she called my wife, who came home right away. This is early cell phone days, and then I kind of felt better. It's like, okay, I'm not sure what's going on, but I think I'm okay. And then started throwing up during the night. No chest pain, no shortness of breath.
Can I stop you here for a second?
Please.
Surgeons have this kind of soldier on mentality, which serves them well in their training and through tough cases.
Yeah.
But on a personal level, sometimes it does not serve you well.
Correct. Yeah,
and I think that's what's going on here.
Yeah,
and it can't. It's kind of a how airline pilots, they talk kind of in a way. Surgeons kind of act in a way like that. And the training ingrains that within you, which is good, but this is probably what's happening here. You're soldiering on and not paying attention to the obvious signs.
Right.
Yeah.
And then the next morning, Sunday morning, I still felt pretty terrible. And, we're thinking maybe I have a stomach flu, but my, wife is, we're going back to the hospital. So we went to the emergency department. It's a Sunday morning. There's nobody around. And the ER doc happened to be someone, my wife's also a physician, someone that my wife trained with at Jewish Hospital when Jewish Hospital was its own entity.
Yeah.
Dr. Brown, a wonderful guy. And he's like, "Mary, why are you here?" It's like, "Oh, well, John just had surgery." And I remember I'm sitting there in the waiting room, and my main symptom was nausea. And so they kind of triaged me. I'm there, and there's, teenagers with, sprained ankles getting in ahead of me. And I'm sitting there, kind of nauseated, feeling, terrible, but no chest pain or shortness of breath. And then she said, "Well, he just had heart surgery." "Well, is he having chest pain, shortness of breath?" "No." "Oh, okay. He can go sit over there."
Yeah. You're on the back burner now.
Yeah. And so thankfully this ER doc saw us and kind of got us back there, back to the, and then the PA of my heart surgeon, came to see me, and it's like, "Well, okay, you seem to be all right." Liver enzymes were up a bit, so they admitted me to the hospital. Got an ultrasound of the gallbladder there, thinking that was it. Then I started vomiting again. They put an NG tube in. And then we didn't get an echo for whatever reason for about 1.5 days.
Yeah.
And they got an echocardiogram. They're like, "You got some fluid around your heart." And so I had to go back to surgery just to get a chest tube put in, basically, to drain that fluid. And my heart surgeon came, was like, "That's the biggest effusion I've ever seen." So, so I felt better, but it took a long time to bounce back from that.
This makes me think of two things. One is, this is the advantage of being in good shape.
Yes,
if you are strong, if you are healthy, you're able to sustain significant medical issues and get past it. And so that's the reason you need to keep yourself in good shape. When you do get sick, which everybody will, you could say, "Well, I've done everything right. Why am I sick?" And the better way to look at it is, you know what? I'm strong going into this. I've kept myself in good shape, and that will help me get through this better.
Correct. Yeah.
The other thing is
absolutely
being married and having a wife to tell you, "Hey, we're going to the hospital." is so. I encourage young men to get married because it typically leads to a longer life.
Oh yeah, that's very predictive.
For a multitude of reasons, and sometimes because they're a voice of reason in these scenarios.
Yes,
so so take me through how you felt like mentally and emotionally as you were going through that, and when you considered the prospect that this may limit the length of your life?
Yeah. I don't think I ever really felt necessarily like, okay, this is going to shorten my lifespan. I did have some heart surgeons say, so the original surgery I had, thankfully, my valve was salvageable, so they're able to repair the valve. So I had what's called a mitral valve repair.
Okay.
So I did not have to get a prosthetic valve. Now they did what's called an annuloplasty. Basically, the kind of circular area where the valve resides was a little bit wider than it should be. So they tightened that up with a ring annuloplasty, basically a little, Gore-Tex ring.
Okay.
But there's no prosthetic valve. So I did not have to be anticoagulated.
Yeah.
And in theory, that should be kind of a life-lasting repair. I initially had actually one of our heart surgeons here who's not here anymore say, oh, yeah, you're going to have that redone in 5 or 10 years. And here we are 20 years later. And
There's always a naysayer. There's always a naysayer.
Yeah. And so for that moment, that kind of ruined my lunch that day. I'm like, what? So
Haters going to hate.
But so I would say I didn't then, nor do I now feel like, okay, my life's going to be shortened because of this. But having gone from what I felt like I was in tip-top shape and on kind of on top of the world, kind of with my job, great job, as long as you have your health, you have everything, right? And, so that took a hit in the sense that after the surgery, obviously, huge operation, and then the second surgery to drain that fluid around the heart. And I was just, as the saying goes, as weak as a cat afterwards. And that was difficult. That was really hard.
Yeah, you got young kids, you want to play with them, and you can't.
And it was, it was 6 to 8 weeks for it. And I'll say at that point, I was 88 to 90% recovered. And then it was another 6 to 12 months till I really felt like kind of at the 100% level, maybe even a little longer than that.
Yeah.
It took a long time.
This is one thing, concept that, I remind people of all the time, when you lose strength and stamina so quickly, when you're in the hospital, I don't care who you are, and it takes a long time to build it back up. Mm-hmm. And, Warren Buffett has a joke on this. He says, you can't get 9 girls pregnant and have a baby in a month. Yeah, Some things just take time. So it's good to be realistic and patient and say, hey, I will get stronger, by progressively overloading myself and doing a little bit more slowly.
Yeah, sure.
And get back. Do you feel like it made you a better physician going through this?
Oh, without question. Because I can tell if having either a urinary catheter or a chest tube or an NG tube, nasogastric tube, I've had all those things. Yeah. And they're like, oh, you don't know what it's like. And I try not to be that guy that's like, oh, well, let me tell you my story. It's like, you know what? I know exactly. I actually do know exactly what you're going through. So I think, not that I would want any of my fellow physicians to, against their will go through anything like this. I think there used to be times during, medical student training that they put NG tubes in each other.
Oh, really?
I think thankfully those days are gone. But no, I think having gone through that, there was no question. It made me, a lot more sympathetic to their plight. And again, obviously I'm a surgeon. That's my main focus, but I don't just leave it at that. Try and figure out, okay, how can we get these people active again? What's the best way?
For sure.
In the short term, let's set up a very specific plan, not just like, don't do anything for 6 weeks. It's like, okay, well, that's not very helpful. Yeah. So I tell almost all my patients, if they're good enough to go home, they're good enough for a daily walk. Yeah. And I'm not, since I'm, focused on the abdominal type stuff, they can usually get out of bed and bear weight. And so they can get outside, as I tell them, get outside, feel the sunshine, feel the wind blow, hear the birdies sing, all those things are very positive. And if you just make it to the neighbor's mailbox and back, that's great. Yeah. That's the first day. The next day, make it to 2 neighbors away's mailbox. Just a little bit of progress.
The strength that counts is the lower extremity strength. Oh, yeah. Doing curls at the gym till you're, indefinitely will do nothing for you in life, but having strong legs and your glutes and your core strong, that will get you through the hard time. And psychologically, just going for a walk and breathing the fresh air and feeling the sunshine is so good for you. Yeah. And so I do the same thing with my patients too. I have kind of a mantra. I say, keep your legs moving, your belly full, and your chin up, because I'm trying to fatten my patients up exactly. Because they're going through cancer treatments. But and then the other thing that being a patient and realizing if you have a good doctor, When I've been a patient, I was fortunate enough to have very good doctors.
Yeah.
And just their confidence, their reassuring me, it like meant the world, because
Absolutely.
I was afraid. I mean, I was trying to pretend like I wasn't, but like I was afraid, and having somebody come in and put their hand on me and say, "Hey, we're going to be okay here.
Yeah.
We've just got to kind of go this way or that way, but just hang in there."
Right.
That when you say it as a doctor, you're like, I don't know if that resonates with anybody, but man, as a patient, you're like, oh, thank God that this guy's here for me.
Yeah.
And so,
I agree completely. Yeah.
Well, John, I appreciate you sharing your story with us. I think it's a unique perspective when you're a physician and then you become a patient,
right?
And especially when it's something so significant. And I think there's kind of plenty of lessons to be learned.
Yeah. Well, thank you. Thanks for having me. It's always a pleasure.
Yeah. Thanks.
Join us next time for Doc Discussions with Dr. Jason Edwards. It's medicine for your body, mind, and spirit.